How long does Suboxone block drugs? Drug addiction is a major health concern for many people across the world. It claimed the lives of nearly 92,000 people in the United States alone in 2020. Fortunately, many different treatments are available to help people overcome their addictions. One of the most popular is medication-assisted treatment, or MAT. This video will discuss Suboxone, how Suboxone works, and how long it can block the effects of opioids. Suboxone is a combination of two drugs, buprenorphine and naloxone. It is commonly used to treat opioid use disorder, or OUD, and works by blocking the effects of opioids. When taken as prescribed, Suboxone helps reduce opioid cravings and withdrawal symptoms. Buprenorphine is an opioid partial agonist. It binds to the same opioid receptors in the brain as other opioids like heroin or prescription painkillers. It allows it to reduce cravings and provide some sort of relief from OUD. It has a higher affinity than other opioids, displacing any effects from other opioid full agonists, such as morphine and methadone. Suboxone has saved many lives by providing an alternative to opiates. It effectively reduces the risk of overdose and helps people maintain long-term sobriety. However, patients must only receive Suboxone in a supervised setting and must be monitored by their healthcare provider throughout the treatment process. Only licensed healthcare providers can prescribe Suboxone and must adhere to strict guidelines. The drug is typically prescribed in a tapering dose, meaning the dose gradually decreases over time as the patient becomes more stable in recovery. Naloxone is an opioid antagonist and overdose rescue drug. In the event of an overdose, naloxone can reverse the effects of opioids and help save a life. It does this by blocking opioid receptors in the brain, thus preventing any other opioids from binding to them. It's important to know that saving someone from an overdose must not solely rely on naloxone. If large amounts of opioids have been ingested, naloxone may not be able to reverse the effects and may require additional medical help. If someone has been given naloxone and still appears in danger, seek medical help immediately. Only medical professionals can provide someone who has overdosed with the proper care. Naloxone is included in Suboxone as a safety precaution. It helps ensure that intravenous abuse of buprenorphine does not occur. Someone with high opioid tolerance might try to inject buprenorphine to experience euphoria, but naloxone will block such effects. It depends on several factors, including the patient's metabolism, the dosage of Suboxone, and the length of time it has been taken. Generally speaking, buprenorphine in Suboxone can block opioids for up to several days. On average, it's usually 36 hours or more. Buprenorphine's half-life is up to 4 to 5 hours. It takes approximately that long for the drug to be reduced by half in the body. Buprenorphine is taken as a tablet or film and dissolves under the tongue. Its peak effects usually occur within 40 minutes to 120 minutes. Suboxone blocks the effects of opioids, such as heroin, fentanyl, or morphine, for at least 24 hours. Suboxone inhibits the action of other opioids and opiates through a mechanism known as affinity, the ease with which an opioid may bind to a receptor. All opioids function in the brain by binding to one or more opioid receptors. These receptors are known as the mu, delta, and kappa, with the mu being most related to euphoria, sedation, and overdose. The affinity values of various opioids vary. Because only one opioid molecule may occupy a receptor site at a time, opioids with higher affinity can reside on the receptor and prevent other opioids from adhering to it. Opioids can be partial or complete agonists. It can only partly activate the receptor, decreasing or possibly eliminating its potential to create a high. It is one of the reasons why buprenorphine is so effective for opioid addiction treatment. It alleviates withdrawal symptoms and drug cravings, but does not often provide euphoria in those with strong opioid tolerance. Methadone, another opioid used in opioid maintenance treatment, is a complete agonist. However, it produces less pleasure due to its delayed action. Opioid use disorder is a severe condition, but with proper treatment and maintenance, you can live the sobriety you deserve. Suboxonedoctor.com is here to help. Our team of experts provides the necessary counseling and medical care you need to recover from opioid addiction successfully. Suboxone, accompanied by behavioral therapy and counseling, provides the support and guidance necessary to break free from opioid use. We believe in taking a holistic approach to treating opioid addiction and providing our patients with the best possible care. If you or a loved one is struggling with an opioid use disorder, please reach out for help by contacting us today. We are here to help you get on the path to recovery.